บ่แม่นแน่เพิ่นก็บ่ได้จังว่าล่ะเริ่มบ่11 9:11แล้วเด้
โอเคแล้วเขาว่า
ยอดเข้ามาแล้วว่ายอดดร.บุญยอดแนบบ่ได้
แล้วกำลังแอดมิดเพิ่นตั้งใช้พวกมันออโต้เข้านั่นนี่นะมันต้องได้แอดมิดเข้านั่นนี่
ดร.บุญยอดอันเข้ามาแล้วเนาะอันต้องขอโทษหลายๆเด้อเพราะว่ามื้อเช้านี้อันอินเทอร์เน็ตเฮามันมีปัญหานิดนึงแล้วก็เครื่องระบบเพราะฉะนั้นต่อไปนี้อันขอเชิญดร.บุญยอดกล่าวเปิดอันสัมมนาของเฮาอย่างเป็นทางการเนาะขอเชิญดร.บุญยอดเลย
ครับขอบใจหลายๆเนาะก่อนอื่นขอสบายดีบรรดาแขกทุกท่านเนาะท่านหญิงท่านชายเนาะที่ให้เกียรติเข้าร่วมการประชุมทางออนไลน์และทางห้องประชุมเนาะมื้อนี้ข้าพเจ้าก็รู้สึกดีใจที่ได้ตั้งหน้าให้คณะศูนย์โภชนาการกระทรวงสาธารณสุขเนาะให้เกียรติมาเป็นประธานกล่าวเปิดการสัมมนาหัวข้อการศึกษาค้นคว้าการส่งเสริมโภชนาการในโรงเรียนแบบสังเกตการจากประสบการณ์ของโครงการSEAMEO RECFON เนาะถือว่ามื้อนี้ก็เฮาจะได้รับเชิญจากอาจารย์หรือว่าพิธีกรผู้ที่มีสุขุนวุฒิผู้ที่มีความรู้ความสามารถเนาะเพื่อจะได้มาได้เปลี่ยนบทเรียนกับบรรดาผู้แทนเฮาเนาะแต่ของประชุมเฮาครั้งนี้ก็ใช้เวลาประมาณครึ่งคาบเนาะแต่ว่าก็มีหลายหัวข้อที่พวกเฮาจะได้ปรึกษาให้จะได้ให้เวียงานเนาะโภชนาการบรรลุตามจุดประสงค์คันหมายคือดังพวกเฮาฮู้เนาะว่าเวียงานโภชนาการก็เป็นสิ่งท้าทายเพราะว่าปัจจุบันนี้ก็สภาพเศรษฐกิจยุ่งยากไฟเงินเฟ้ออัตราราคาสินค้าแพงน้ำมันแพงเนาะมันส่งผลกระทบต่อเป้าหมายของพวกเฮาเนาะการเข้าถึงแหล่งอาหารมันก็ทุดหน่อยถอยลงอันนี้เนาะบ่ว่าแต่ว่าประชาชนหรือว่าชาวบ้านทั่วไปก็พนักงานก็มีผลกระทบตามๆกันเนาะแต่ของประชุมนี้เขาจะมีหลายหัวข้อที่เขาจะได้ปรึกษาหารือเนาะแต่ถ้าว่าผู้แทนท่านใดยังบ่มีเข้าใจหรือว่ายังมีค่าใจเนาะหรือว่าสนใจก็เชิญถามมันทางพิธีกรเนาะในถ่ายชั่วโมงเนาะแต่เพิ่นของประชุมมื้อนี้หรือว่าสัมมนาชุดนี้เฮาสิใช้เวลาประมาณครึ่งคาบเนาะแต่ท้ายนี้ข้าพเจ้าก็หวังอย่างยิ่งว่าบรรดานักสมกรหรือว่าผู้แทนทุกๆท่านเนาะจะได้เอาใจใส่ติดตามหรือฟังทางพิธีกรเพิ่นได้เสนอบทเรียนเนาะหรือว่าประสบการณ์ผ่านมาเนาะในการจัดการปฏิบัติงานโฆษณาการของพวกเฮาเนาะบอกเฉพาะก็หวังว่าผู้ท่านจะนำเอาบทเรียนละเก่าจะเข้าไปในเปียกมูลในเวียงานตัวจริงเนาะโดยเฉพาะเป็นเวียงานโฆษณาการเฮาเนาะให้เกิดผลให้มันบรรลุตามจุดประสงค์คาดหมายเนาะในมาฮานี้เนาะข้าพเจ้าก็ขออวยพรใส่ให้บรรดาผู้แทนโดยเฉพาะไปทางวิทยากรเนาะจากประเทศอินโดนีเซียเนาะที่ได้ให้เวลามาเสนอบทเรียนหรือว่าประสบการณ์เกี่ยวกับงานโฆษณาการของเราครั้งนี้เนาะและขออวยพรใส่ให้บรรดาแขกทุกฐานเนาะที่เสียสละเวลาอันมีค่าเข้ามาร่วมในกองประชุมครั้งนี้ได้ก็ขอขอบใจหลายๆเนาะได้ขออวยพรใส่ให้ทุกฐานเนาะจงมีสุขภาพแข็งแรงมีพลามัยสมบูรณ์มีผลสำเร็จในหน้าที่การงานมีความผาสุกในชีวิตในครอบครัวมาฮอดนี้เนาะเวลาก็ได้ทุกคนเนาะข้าพเจ้าแนะนำคณะจัดตั้งหรือว่าต่างหน้าคณะจัดประชุมหรือว่าแนะนำคณะประธานสัมมนาสุดนี้เนาะข้าพเจ้าขอกล่าวเปิดการสัมมนาสุดนี้อย่างเป็นทางการเนาะนับแต่เวลานี้เป็นต้นไปเนาะขอขอบใจได้ท้ายนี้ข้าพเจ้าขอมอบ ภาระนี้ให้ทางวิทยากรเนาะเพื่อสืบต่อดำเนินเสนอบทเรียนหรือประสบการณ์ต่างๆเนาะขอเชิญขอขอบใจได้ครับขอบใจ
เจ้าดอกขอบใจดรบุญยอดต่อไปก็เชิญProfessor Judith เนาะcontinue for your presentation
Okay, thank you, Dr. Ula, and also the host of the webinar today. Thank you for having us once again on behalf of SEAMEO RECFON. We are of course happy and thrilled to be given this opportunity to share what we have experienced and also the knowledge that we have regarding the research that is involved in our one of our flagship program called Nutrition Goes to School, or NGTS program. I am happy also to know that this session is called Nutrition Seminar Series, and you have what is called as Applied Nutrition Research Capacity Building Project. This is very good, Dr. Ula. Yeah? So on behalf of SEAMEO RECFON, again, we are happy that we can also contribute in the sharing session today. Dr. Ula and colleagues, please allow me also to inform that my sharing today is going to be in a form of discussion, if possible, so that we can have also, I can learn from you, you can also learn from I can learn from you, and you can learn also from my presentation. So please, everyone in this room, if you think I speak too fast, or if you think you have already a questions you would like to address, I think Dr. Ula, with your permission, we can already have a quick Q&A, question and answer session, so that the issues that is burning as a question from the participant can right away being responded. I hope I know all the answers, but if it is not, of course, as I said earlier, it is going to be a sharing session. I will probably invite other colleagues in this room also to respond to your questions. Thank you. So maybe we can go to the next slide. How much time do I have, Dr. Ula, for the presentation? Is it 30 minutes, 45 minutes, Dr. Ula? Can somebody help me? How much time do I have for the presentation? I will try to keep my presentation as scheduled. Anyway, please let me know if
I think depend on you are
on me. Okay, so I have maybe like 1 hour. If I would like to have a Q&A in between, maybe I will need 1 hour for the session. It is okay? Is it okay, Mr. Filasit? Okay, thank you. So I have a long name, but please call me Yudi. I am currently the Research Unit Manager at SEAMEO RECFON.
Yes, Professor, including the discussion 1 hour. Don't worry about time. Yep.
Okay, thank you. Thank you so much. Okay, aside from being the Research Unit Manager at SEAMEO RECFON, I am also a lecturer at the Nutrition Department, Faculty of Medicine, Universitas Indonesia. So I am a nutritionist by training. You see my email address here. So if next after my session you still have questions, please email me. And if you would like to see my work, my publication, you can visit ResearchGate and type my name. You will see most of my publication I put in the ResearchGate. Thank you. Now enough for the introduction. Maybe we can go next slide. Okay, so this is the outline of my sharing today. I will be speaking shortly about types of research, and I will be focusing the types of research, there are so many, but I will be focusing only on observational studies, specifically on cross-sectional studies. And then I will be discussing the program, one of the flagship program we have at SEAMEO RECFON that is called Nutrition Goes to School. I will be speaking about the description of the program, the goal, the coverage, the framework, how the program is implemented, and what are the components and activities, and the journey of the NGTS program in the Southeast Asia. And then lastly, I will be speaking some examples of our published work regarding school-based program. I will be speaking about 4 studies that is I will be using these studies as an example of our discussion. So the first studies is on teachers' experience with nutrition education activities. It is a cross-sectional study. The second one, I will be sharing students' interest in school-based nutrition education. This is a qualitative study. Feeding practices of school-age children during the COVID-19 pandemic. This is also a qualitative study. And the last one that I will be sharing is on school readiness to adopt a school-based nutrition interventions, which we use a mixed methods design. So this is the outline. Can we go next? We will be speaking on the first topic. Next slide, please.
แม่นเพิ่นอันกดสไลด์ให้เราซินะ
Okay. So when we are talking about research, so what is actually a research? If we use the English word research, when I prepare this presentation, I try to understand the word research. I try to understand the definition of research by the word. So research comes from the word search plus re. So if you would like to use Google Translate, what is search? Search is trying to find something. It is searching. When we use the word re, so re plus search is a research. So re means that you do it over and over again to find something. So typically, that is what we are doing in research. So we do over and over trying to find or trying to understand something, a topic of interest. So this is just to open up, just to open up. Now, can we go to the next slide? Next slide, please.
อันแม่นเพิ่นกดสไลด์ให้เราก็กดต่อให้แน่
ของมันค้างเลย
อุ้ยกดได้บ่
Thank you. So when I was given this task to give a talk or a sharing on research, as Dr. Ula was saying to my colleague, Dr. Iis, so I Google, because there are so many definitions about what research is. There are definitions that are too complex in my understanding. So what I did was that I Google, I type research and then I Google. So from Google, research is defined as the systematic investigation. To what? To establish facts, to reach new conclusion. So it really means that we are doing a research. Because we are investigating something systematically, so that we come to a conclusion that we know something, or we come to be able to establish a facts according to Google. According to Wikipedia, they have similar meaning actually, yeah, in terms of research. So research, according to Wikipedia, is a creative and systematic work. Again, the word systematic is being used. Why do we do creative and systematic work? Because we want to increase the stock of knowledge, because we want to have evidence to increase our understanding about a topic. So I would say pretty much the same what Google say and what Wikipedia say about research. It is a process, yeah, that is systematically designed for us, a researcher, to be able to understand something. When I say something, it may mean any topics of research that you are interested in. If you are a nutrition by profession, so you would probably include nutrition topics in this particular research. Okay, I hope this is the basic that we can agree on. Can we go to the next slide? Yes. Okay. Now, research that I used in the previous slide is the basic and most generic one. I believe I learned that most of you are a researcher or people who are dealing with research and related matters with research. I believe epidemiological research or epidemiological studies is a research that is more relevant to most of us. Okay, there are many other type of research, of course, yeah, laboratory research, for example. But since the time is limited, perhaps, and it is beyond my expertise, perhaps today, what we will be discussing is more on the epidemiological research or study. There are again many definitions of what is epidemiological research, as you see here in the slides. Yeah, it is mentioned that the definition is really about study of how often disease occur in different groups of people and why such disease occur. Another definition about epidemiological research is that this research concerned with describing and explaining the occurrence of disease in the population. Another definition of epidemiological research is that this is a study and analysis of the distribution, the who, the when, and the where of patterns and determinants of health and disease condition in a defined population. So these three definition is basically telling us that epidemiological research is concerning with population, and concerning with our interest in understanding the description or the explanation of the occurrence of a certain disease. However, we may want to use the term disease in a more generic term. That is why on the side of this definition, I put exposure and outcome. I am not aware how much all of you are exposed before in this research capacity building project before, but what I would like each one of us today to come to a similar understanding is that in many of every epidemiological research, we should be able to identify the exposure and the outcome. Understanding the exposure and the outcome will assist us in designing our study design because of the research questions that we have. I will come back about exposure and outcome later on when we have a quick interactive session later on. So exposure and outcome in a statistical analysis would be similar or would be translated as exposure is actually your independent variable, okay, and the outcome is your dependent variable. So in many of our attempt in trying to understand a topic, we will need to be able to justify what exposure and what outcome are we interested in. I hope this is clear for everyone. Can we go next? Next slide, please. Okay, so furthering on with the epidemiological studies, I believe many of you have seen this particular chart, but let me use this again for the purpose of leveling up our understanding during my session. So in the epidemiological studies, there are basically two big branch. Yeah, one is on a descriptive studies. Second is on the analytical studies. When we go further, there are many types of descriptive studies. There are case reports, case series, descriptive surveys. Okay, and then when we also elaborate further on the analytical studies, there are two different types that is categorized based on this Cochrane framework. Yeah, so under analytical, there are observational and then experimental. Under the observational, we have three types of studies. They are cross-sectional, case control, and cohort. Under experimental, there are lab trials and field trials. There are many things, of course, when we are talking about epidemiological studies. As I said earlier, if we know what we want to know, if we are able to formulate a proper research questions, whatever research question that you have will have to fall under this type of studies that is on the screen. So therefore, as I said, if you are able to design your research question well, you will know exactly what study design fits to answer your research questions. However, my talk today will be focusing on observational studies, specifically on cross-sectional studies, as it is in the title. Okay, can we go to the next slide, please? Yeah, this one. Okay, now, yes, thank you. Cross-sectional. Now we go to the next slide. Okay, based on the type of epidemiological studies that you have seen in the previous slides, this is another diagram to assist us in understanding the weight of evidence from each and every epidemiological study design. If you see from the bottom, yeah, if you see from the bottom, we have case report, case series, and so on and so forth until randomized clinical studies at the top of this triangle. Okay, please have a look on the arrow of the weight of the evidence. It is really to say to us that when you would like to show the strength of the evidence, the best or the study design which shows the strongest, yeah, the strongest evidence would be an analytical epidemiological studies, specifically using randomized clinical studies. So again, from this slide, we can also say the weakest evidence that can be drawn as a conclusion of a case report, which is under descriptive epidemiology, is weaker compared to randomized clinical studies. I think I'm going to go to the next slide to to explain what does it mean of this weight of evidence. Can we go to the next slide, please? Yeah. Okay, this one. This one. So when we are talking about a research method or research design, it is basically a continuum. When we say continuum, it really means that there is no clear cut, yeah, because it depends on what we want to know. It depends on our research questions, whether you would like to describe a population, or you would like to find relationship, or you would like to justify a relationship that is causal effect. Okay, so when you know your research question, whether it is describing or finding relationship or finding causal effect, so you may use this particular diagram to assist you in deciding which research design that fits to my research questions. Okay, so here you see that the descriptive, exploratory, and experimental design are basically in the continuum of research. And below, all in the gray boxes, are the so many study design that you can think of fits to your research question, depending on whether your research question is really about describing a population, finding relationship, or finding causal effect. At this point, referring to the previous slide, why experimental design is stronger, yeah, or is strongest, it is because by using experimental design, you are able to confirm the causal effect relationship. You know which one is causing which one by having an experimental design. That is why experimental design is always about understanding the cause and effect. Okay, I hope this slide reflects also the previous one. Can we click? Give a click? Yes. This is, can we go first before? The arrow that I gave under qualitative research is also to let you know that qualitative research is also part of a continuum of research, and the function is really about describing population. I am speaking about qualitative research because today I will be also sharing some sample of work that we did with our NGTS program using qualitative research design. Okay, I hope by looking at the 3 slides from this one and the 2 slides before, you now are more capacitated by an understanding on how to select a study design is really guided by your research question or by your research objective. Okay, can we go next slide? Okay, now since I already mentioned about qualitative study, at this slide, I would like also to give you a brief a discussion on what is the difference between qualitative study and quantitative study. So there are four issues here: the purpose, the data type, the approach, and the analysis. Can I ask the committee to also do 2 clicks because I have additional clicks on this slide? Click 1 and then the last one. Yes, can we stop here first? So I add from this slide, aside from purpose, data type, approach, analysis, I also use hypothesis as the way to distinguish the difference between qualitative and quantitative studies. So here in this slide, when our purpose is to answer why means meaning, yeah. then we use qualitative studies. But when the purpose is more on answering how much or how many, then we use quantitative study. We are going to identify proportion or magnitude of a certain problem, for example. Then we use quantitative approach. But when we are trying to seek for meaning of a disease, for example, or meaning of a certain behavior, then we are using qualitative study. When our study is mostly using observation, symbol, words, or text, then we use qualitative study. But when you are using statistical analysis, numbers, then we use quantitative study. In terms of approach, in quantitative study, we use measure and test, yeah, while in qualitative study, we use observation and interpretation of a situation, of a behavior, of a symbol, for example. Okay? Now, in terms of analysis, of course, because we are testing, so we use statistical analysis. You can use whatever software for the quantitative study. In the qualitative study, because our data is basically narrative or text, so what we do is non-statistical analysis. We will be doing mostly a content analysis where we are able to group common data or to try to see some patterns of similarities and differences. The last one, in qualitative study, we do not test hypothesis. What we do is hypothesis generating. So we create a hypothesis through qualitative study. That is why in qualitative study, it is mostly done because of an exploration that later on the hypothesis that we generate is tested through a quantitative study. So that is why the characteristic of quantitative study, you are always testing a hypothesis. I hope this one is clear. Maybe we can go next first to the next slide. Okay, now we go to the next type. Okay, in recent development, researcher, program evaluators, governments, development agencies have come to an understanding that using a single study design sometimes is not enough to clarify or to make us understand on a certain topic. And there comes the combination of the quantitative and qualitative study through what we call as mixed method research. Okay, in this slide, it is mentioned that that mixed method research is a research approach that is used for questions that require real-life contextual understanding, multi-level perspective, and cultural influences. It employs quite sophisticated quantitative research because this study would like to assess the magnitude and the frequency of a certain construct or certain concept. Okay, but at the same time, mixed method is also using a qualitative research because at the same time, aside from only wanting to know the magnitude, we also want to know the meaning and understanding of a certain construct or a certain topic. Okay, so therefore, mixed method research is also a research approach that intentionally integrating or combining these two methods to draw on the strength of each other Remember from the previous slide, in terms of types of data, in terms of the purpose, quantitative and qualitative are different, but sometimes to understand a topic, for example, in a program evaluation, nowadays, many development agencies are using this mixed method approach because it helps them to give numbers, to give magnitude, but at the same time, it helps the program evaluator also to understand many phenomenon that is found after a program is being implemented. In Nutrition Goes to School later on, we will be also sharing a sample of mixed method research. Can we go next to the next slide first? I think we still have some more slides on mixed method research. Can we go next? Yes. Okay. So this is why qualitative and quantitative research are complementary. Yeah, because while the qualitative can facilitate quantitative by identifying topics for survey, for example, yeah, or qualitative can help to interpret and give meaning to the quantitative research finding. Quantitative can also facilitate qualitative study by generalizing findings to larger sample, because qualitative study is not used for generalization purpose. If your study, if your research question aims for generalization, then you should not use qualitative study. You use quantitative study. But what is also interesting about mixed method, mixed method is that in the quantitative, your qualitative study can also assist your qualitative study in making an attempt, yeah, to generalizing the findings from your qualitative study to a setting that is similar to that particular qualitative study into a larger sample. Okay. Quantitative can facilitate qualitative study by identifying groups that warrant in-depth investigation. Yeah, so for example, you are having a survey, quantitative survey, and then you, based on the survey, you found about 10%, for example, of your study samples have a very limited knowledge, for example, on hygiene practice. Yeah, as a researcher, or in this case, perhaps you are also a program implementation staff, you may want to dig further, yeah, to dig further on that particular samples who you know from your survey have a very low understanding on hygiene practice. You may want to know why, because you want to know the meaning of why are these people having such a low understanding compared to the other 90% of your study samples. So this is the beauty how, as a researcher, you can complement your quantitative research with qualitative research, or your qualitative research with your quantitative research. Okay, we can go next. Okay, so mixed methods can come at various stage of your research. It may come from the very first, yeah, from the very first of your definition of a research question. By having a complex research question, you may want to address a range of research objectives. For example, here, in an intervention study or in an experimental study, your qualitative research is really to explore how the intervention is used in practice. Yeah, you want to know how people are benefiting your intervention. In your quantitative study, you want to measure the outcome of your intervention by having by running a quantitative survey, so you know how many are experiencing your outcome. Okay, that way you know the magnitude. Or on the level of data analysis. So you are combining your statistical analysis, as I said earlier. Yeah, you know 10% of your study sample had low knowledge on hygiene practice. So you may want to use this combination of information with some narrative data from your qualitative study to explain what is happening. Why this 10% of your study sample had low understanding on hygiene practice. That is in the level of data analysis. The next one is in the interpretation stage. The qualitative method can be used to explain relationship between variables, explore puzzling or contradictory results arising from your quantitative study. You know, when you have already the experience of doing your data analysis and finding some paradox in your quantitative data, as a researcher, you may have this question: why this is in contradiction with the norm? Why the result is not common? So as a researcher, if you have that questions, now that particular curiosity can be answered by designing a mixed method. You may want to run the second run of your data collection stage by having a qualitative study, trying to find the meaning, the reason of some of these contradictory results from your quantitative study. So these are all possible by having a mixed method design. Can we go next slide? Okay, and this is how we can connect the data through mixed method design. It is either merging the data. I think it is easier to see the diagram, yeah, rather than to understand the text on the left side. Merging the data, so you have your qualitative data, you have the results. You have qualitative data, you have quantitative data on the other side, and then the result you combine. You are trying to understand your research objective by providing evidence both from the qualitative and the quantitative data. That's merging. Connect means you connect. For example, here you start with your qualitative research, you have your qualitative data, and then you have your quantitative data, and then you connect the finding of qualitative and quantitative to become one data set as your results of your research. Okay, the last one is embedding. Embedding really means that one of your method is actually part of the other one. In the figure on the right side, you see the qualitative is part of the quantitative one. It depends on your research question. It can also, your qualitative is your main and the quantitative is part of. It depends on the research question. I just show you this slide so that you have this variation that you can use later on when you think this is relevant for your future work. Yeah, we can go next slide, please. Now, this is an exercise. Dr. Ula, can I invite the participant to also participate in this exercise and do typing at the Zoom chat, Dr. Ula? Is it possible?
Yes, you
we
can
yeah.
possible.
อัน
Okay.
นั้น
เนาะมีแต่ว่าเพิ่นสิเฮ็ดอันบทฝึกหัดเนาะมีแต่ว่าให้อัน
Yes, in the
มี
Zoom
แต่ว่า
chat.
เฮาเขียนอยู่หน้าตอบอยู่หน้าแชท
Yeah.
Zoom เนาะ
let's try one by one, yeah, Dr. Ula, yeah. Maybe let's try number 1, yeah. If I have a title of my research like number 1, association between eating practices at breakfast and diet quality among adults living in urban and rural areas of Indonesia. Number 1, what do you think is the study design of number 1? Can anybody try to share in the Zoom chat? Let's see how much the sharing of one part of my sharing is digestible to all of you. Can anybody start chatting? I see some colleagues from SEAMEO RECFON is also joining. Cross-sectional study, number 1, yeah. Can we go for one click, Dr. Filasit, Mr. Filasit? Can
I
we
think
go
the
one?
cross-sectional study.
Cross-sectional study, yes. To be more specific, it is a quantitative cross-sectional study. Thank you. Can we go to number 2? Who would like to share? You can open mic if you don't want to type.
Yeah, you can speak.
You can speak if you do not want to type. How about number 2? Experience of prospective brides about factors that shape nutritional preparation during preconception period in Bogor, West Java, Indonesia. What do you think this is? What design is this? Can anybody speak? Or if you don't want to speak, maybe you can type. Either way. Anybody?
I think it's a cross-sectional again.
It is also cross-sectional. Okay, it is cross-sectional, but
qualitative.
Qualitative.
But qualitative. Okay,
Yeah, qualitative.
can we have one click now? Click. It is a qualitative study, yeah. There is a certain characteristic. I will be speaking about this when we answer all 5, yeah. Okay, let's go with number 3. Anybody would like to study this one, number 3? Oh, cohort study. We can design a cohort study for number 2, but maybe the title would be different, yeah. Slightly different. Can we go number 3? What do you think this is? Association between ultra-processed food, sugar-sweetened beverages consumption, and body mass index of senior high school students in Pontianak City, West Kalimantan, Indonesia. What do you think? You can type or you can speak. It's up to you.
I think, yes.
Yeah, I think.
Yeah, I think that it is one group and we would like to know maybe comparison about, how to say in English? อาจารย์
Maybe you can speak in Lao. Dr.
Yeah.
Ula will translate.
อันน่ะแบบอันน่ะเขาอันน่ะ quasi อันน่ะ experientially นะอาจารย์มันจะบ่แม่นอัน experientially เต็มแต่มันสิเป็น quasi แม่นบ่
Quasi experiment, yeah. You think this is a quasi experiment. It can be true, yeah. It can be true, but maybe let's click first number 3. This is actually still a quantitative cross-sectional study. Okay, so we with the I will speak about the quasi experiments, the type, that typology of the experiment and how we put it in a title of research, yeah, Dr. Somfon. But for number 3, it is still quantitative cross-sectional study. Thank you for the contribution. Let's go to number 4. Anybody would like to try number 4? The exploration of the implementation of MMS among pregnant women to prevent early life malnutrition in East Java, Indonesia. Anybody would like to start? Okay, Dr. Somfon again. Maybe you would like to try? It's okay.
RCT randomized control trial.
This is an RCT. Okay, so you are also aiming at the experimental design, yeah. Okay, maybe let's have a click.
Speak aloud there, Sid. Oh,
It is a qualitative study, Dr. Somphon. It is a qualitative study. I will speak about the different of this later on when we finish until number 5, yeah? Okay. Now the last one. The last one. Anybody would like to try? Economic evaluation on integrated nutrition rehabilitation program in early childhood education center for promoting growth and development of under 5 children in East Lombok, West Nusa Tenggara, Indonesia. Anybody would like to try? Or RECFON colleagues, whoever is here, would like to try? I see some colleagues from SEAMEO RECFON attending. What do you think?
ให้ครูลองต้องดู
Nobody would like to try?
I'm not sure, but I think it look like the cross-sectional study.
This look like a cross-sectional study. Okay, thank you, Maiko. Now let's have a click for number 5. It's mixed method. So let me tell you, this is just an exercise, by the way. Yeah, this is just an exercise. It may not be always accurate the way we put the title of a research to reflect right away the design of the study. But let me tell you that these 5 topics is an actual research topic that my student from the nutrition department of Faculty of Medicine, Universitas Indonesia are doing. So this is a real study. For number 1, a few of these are basically already published. So some of our student has graduate, but there are also from this title that are still under the under data collection. So let me tell you why we use this particular term to be able to identify the design. So if you notice number 1 and number 3, I think most of you got it right, yeah, that this is a quantitative cross-sectional survey. If you recall, my sharing today is really about observational studies. So therefore, many of what I am going to share with you does not cover anything about experiment design, yeah, experimental design or quasi-experiment, or Dr. Somphon mentioned about randomized clinical trials. So I will not cover those design, Dr. Somphon, in my session. So that is why when I have this exercise, I intentionally pick up this topic that is relevant to my talk. Okay, so Dr. Somphon, when you say number 3 as a quasi-experiment, the title would look like this, Dr. Somphon. If it is an experiment, you would say the effect of ultra-processed food and sugar-sweetened beverage consumption on body mass index on blah, blah, blah. So that would characterize that it is actually an experiment. Okay, but we will be discussing about that, Dr. Somphon, I think next month, yeah, with my other colleagues who is going to share with you on the experimental design to complement the topic that I covered today. Okay, and then I would like to also speak to Maiko for number 5. Maiko, you were saying that this is actually cross-sectional. You are correct, yeah. So this is a cross-sectional study that is using mixed method, to be more specific. Yeah, so mixed method is mostly being used for a cross-sectional study. Why this is a mixed method? Because our student on number 5, yeah, is really using some quantitative measure to generate magnitude, yeah, to generate magnitude of the growth and development of the children that is covered by the program called Integrated Nutrition Rehabilitation Program. Okay, so she is using both quantitative and also qualitative to be able to understand the economic evaluation of the program. Okay.
Dr.
Yeah,
Julie,
Michael?
but the
Sure.
number 5, but the
Yes.
topic is look like we using some intervention, right, to doing the evaluation on integration on nutrition
Yes.
in early childhood, right?
Yes. Yes. So the intervention part already passed, Michael. The intervention part already passed. They already know the result of the intervention. But after the intervention, like 1 year after the intervention, we run this
Okay.
cross-sectional survey to understand the economic evaluation. Yeah,
Okay.
you are correct, Michael. So it was designed as a intervention. So if it is an intervention study, the title would be the effect of integrated nutrition rehabilitation
Yeah.
on
Yeah.
growth and development of the children. That would be the title if it is an intervention. But this is after 1 year after the intervention. Thank you, Michael, for bringing
Okay.
that up. Yeah. Okay. I hope this clarify the point I raised on the study design. So the clue is, because my topic is on cross-sectional study design, so I will be speaking mostly about cross-sectional study, quantitative, qualitative, and mixed method design. Okay. I still have one more exercise. This time, can we go to the next slide? I am still going to use the same title, but this time I would like all colleagues here who are attending this session to exercise when you see these 5 research topic, which one is the exposure and which one is the outcome. Let us exercise with number 1 first. Anybody would like to try? When you see number 1, which one is the exposure and which one is the outcome?
Eating practice breakfast is the exposure.
Yes, and then the outcome is?
The outcome is the quality among of the adult livings.
Yeah, so the outcome is the diet quality. You are correct, Michael. I think you deserve a chocolate bar. Maybe we can ask Dr. Ula to give you chocolate bar.
Yeah, I will give him.
It's okay. It's okay.
Can we have a click for number 1? I think what was addressed by Michael is correct. Yeah, so the exposure is eating practices at breakfast, and the outcome is the diet quality. Okay, can we exercise more on the number 2? Number 2, anybody would like to try? What do you think is the exposure and what do you think is the outcome for number 2? Sorry, for number 2. Anybody would like to try? We have already a good example for number 1. Anybody? Not yet? Maybe we can open first. Can we have a click for number 2? Let's click number 2.
Sit click cái nào đây? Sit click.
Does it open? Yeah, it opens. Yeah. So remember, if you remember, number 1, previously number 1 is a cross-sectional study, yeah, quantitative cross-sectional study. Number 2 is qualitative cross-sectional study. But still, we can identify what are the exposure and what are the outcome. Okay. For number 2, the exposure will be the experience of the prospective brides. On what? Yeah. On anything. Yeah. On anything that would help them to understand the outcome, which is the nutritional preparation during preconception. Okay, so there is always these 2 issues that you need to address when you are designing your research. You will have to what is it? You will have to confirm yourself, to convince yourself that you know what is the exposure and you know what is the outcome, so that you know what you want to know about the 2, the relationship. You want to know the causal effect or you want just to know the association. Okay, how about number 3? Anybody would like to try number 3? Exposure, what is the exposure? And the outcome, what is the outcome?
I
Michael?
think the exposure is the ultra processed food, sugar, sweets, beverage consumption.
Yes.
Yeah,
And the outcome is?
the body mass index among of the seniors high school student. Yeah.
Exactly. Again, I think 2 chocolate bar for
Two
Michael,
chocolate
Dr. Ula.
I will give him more.
Can we click number 3?
Yeah.
Yeah, so UPF and SSB consumption is indeed the exposure, and the outcome is the BMI of the high school students. Okay, how about number 4? Number 4 is also a qualitative study similar to number 2. Anybody would like to try? What is the exposure and what is the outcome? Anybody? Anybody do some chat maybe?
Again, I think the
Michael, why not? Okay, go ahead, Michael.
micronutrient supplementation is the exposure.
Is the exposure, yeah, maybe the implementation, to be more specific, yeah, the implementation of the MMS program. Okay, that's the exposure. How about the outcome?
The outcome is the life malnutrition for malnutrition for women.
Okay,
To prevent the early rise. Yeah, is the outcome.
Okay, nearly correct. So maybe it's half chocolate bar, Dr. Ula.
So, Professor Judy,
Yes.
can we say for the outcome, for example, if we provide the micronutrient, so we can test the iron of the pregnant woman can be outcome or no?
That depends. Yeah, that depends.
But depend on the supplement, right? Like if we provide the irons, we can test the anemia is the outcome, right?
Yeah. But since this is an MMS, iron
These are
iron is going to be one of the nutrient, yeah, that is included in the supplementation. So testing iron can also be an outcome, Dr. Ula, if you want just to see the MMS and the effect to the pregnant women. But remember, in this title, this is not the intervention. This is an exploration. Yeah, this is a qualitative study. If you look at into the title of this topic, number 4, the outcome is actually on the malnutrition rate, yeah, of the children born by these pregnant women. So again, similar to number 5, number 4, the intervention already passed. Yeah, the intervention already passed. The study for number 4 is really to understand how the pregnant women experience the MMS program and how the MMS program has benefit the children born by the women. So that's why the exposure will be the implementation of the MMS among pregnant women. The outcome is the malnutrition rate suffered by the children born by the women. If we would like to have this as an intervention, the title would be, as I said earlier, yeah, the effect of the implementation on MMS on women and then on the children, Dr. Ula. So you can have like 2 outcome. Yeah, you can have like 2 outcome. Or if your study is interested and at looking at the outcome on the children, so you see the outcome on the children. So it really means that your intervention should allow time for all the subjects to deliver the baby. Yeah, so that you can assess the outcome of your intervention on the baby. But if you would like to see a short-term outcome, you can also see whether the MMS program, which also consists iron, would have an effect on the anemia among the pregnant women. So it depends on your research question, Dr. Ula.
Yes, thank you.
Okay, number 5. Let's open number 5. Maybe in the interest of time, let's open number
Click the
5.
receipt.
Yes. So for number 5, as also addressed by Maiko, yeah, in the when we discuss about the study design. So the intervention on integrated nutrition rehabilitation has already passed. After 1 year, we would like to know if the intervention is lasting to the community. That is why an economic evaluation is being assessed. So in this case, the exposure is the implementation of the program itself, yeah, the integrated nutrition rehabilitation program. On what? The outcome is the growth and development of the children, as it is stated there. Okay, so remember, my topic is about cross-sectional, so maybe we can focus first our understanding and discussion on this particular cross-sectional study design. But from time to time, when you think it is also relevant to discuss an intervention or experimental design, of course, we can also discuss and hopefully I can respond to that questions. Okay, I think this is the last of one part of my talk. Do you have any questions?
ผู้การมีคำถามยังบอก
So far so good, maybe Dr. Ula?
ก็ถือว่าเราเว้ามีประโยชน์หลายเนาะเพราะว่าก่อนเราสินำเสนอตัวอย่างของการ ก่อนที่เพิ่นจะนำเสนอเกี่ยวกับตัวอย่างของการค้นคว้าผลของการค้นคว้าเกี่ยวกับเรื่องโภชนาการในโรงเรียนนะคะเพราะว่าเซมินาหัวข้อเซมินาครั้งต่อไปเพิ่นจะเห็นตัวอย่างการค้นคว้าว่าออกมาเป็นคือจังได๋
So far so good, maybe Dr. Ula. Maybe we can carry on.
Yes, please.
Yes. Let's continue. Maybe we go to the next topic. Can we go to the next slide? This is the second topic. We were given also the opportunity by Nutrition Center to also speak about our Nutrition Goes to School program. So the next few slides is really about Nutrition Goes to School program, which aims to develop an awesome children in Southeast Asia. Can we go next? So in terms of the program, in terms of description of the program, it is a school-based multi-sectoral program emphasizing the role of schools as an effective media or venue for character building education that is centered toward good nutritional practices both in school and at home. So this is the description of the NGTS program because of prior experiences on using the school, yeah, as a venue, an effective venue to influence students to be able to develop good nutritional practices. So the use of school as character building education is something that we are making a good use of the school in our NGTS program. Okay, in terms of goal, we would like, as in the previous slide, we would like to develop an awesome student. And awesome, in this case, is an abbreviation of active, well-nourished, smart of me. Okay. So when in terms of our coverage currently, thank you. Our current coverage, we have primary, secondary, vocational, and Islamic school currently, and our expansion our expansion coverage in the maybe towards the end of our third 5-year development plan is currently we are working on boarding school And hopefully, after we are able to cover boarding school, we could also be working with special education school to implement NGTS. Okay, can we go next? So this is the framework of our NGTS. At the center, as I said earlier, our aim is really to develop an awesome school children. How can we develop these awesome children? Is first, the foundation is the nutrition education. The nutrition education is really the component where we centered our activities to enhance the knowledge, the skills, and the attitude of the school teachers, the students, as well as the school communities in general on proper nutrition. How do we do this? Is actually through intracurricular activities and extracurricular activities. Okay. The next important framework is actually the wall. Yeah, if the foundation is the nutrition education, the wall is the school environment. What do we mean by school environment? Here is the physical and socio-cultural settings within the classroom, inside the school premises, and its immediate surrounding, affecting the promotion and practice of proper nutrition. That is why in many practice of our school environment, we include school canteen as well as the school garden. Okay, the top, the top or the roof, I would probably say the roof of this framework is really the policy and management support, where we aim for any written commitment, any organizational setup and human resources uh, support, human resources support that will enhance the implementation, the promotion, and the practice of proper health and nutrition among the school community. So we are using this framework in the implementation of our program. Can we go next? And this is the implementation phase. So throughout a period of 3 years, we influence the school to implement the NGTS program into phases. The first phase is the initiation. This is where the school are exposed with NGTS activities, and the schools are exposed with NGTS training, specifically among the teachers and the school heads, where they develop an NGTS action plan right after the training. That's the initiation stage. And then on the strengthening stage, after initiation, we would like them to implement the action plans. And during that strengthening phase, RECFON and partner institution will provide technical assistance to the school for the implementation of the action plans. We together monitor the progress and also document the best practices. So there are already some challenges actually in the strengthening phase, but there are many schools who also survive into the institutionalization phase, which is the last one. Institutionalization phase is really to tell that the school is an independent school for the implementation of the NGTS, because they have shown a written commitment, routine progress reporting, and establishment of linkages between the school and relevant stakeholders surrounding the school premises to sustain the programs. And in this year, there are already 23 schools from so many schools who survive the institutionalization phase in Indonesia. So we will be having a ceremonial session during our governing board meeting, where Dr. Pasuk, as our governing board member from Lao, will be also present to witness this very important moment for the 23 school in Indonesia to be able to achieve this institutionalization stage. Can we go next? And these are the components and the activities. So basically, there are 4 components in NGTS: the nutrition education, the school canteen, school garden, and nutrition entrepreneurship. There are many activities that we list here, but eventually there are many more activities that the school can do because of their own initiation. So on the institutionalization event this coming weeks in September during our governing board meeting, we will be witnessing that there are many more activities that institutionalized school are able to initiate very innovative activities. Maybe we can go next.
ดร.บุญยอดมอดเสียงเดท่านมอ
Okay, and this is the journey. So in terms of establishing a flagship program, of course, it is not easy. It is not easy. We started off in 2016, where we conceptualized the idea, and then we received approval from our governing board members. And then in 2017, we are piloting the program in 7 locations in Indonesia only. There were 83 schools that is in the piloting stage. In 2019, we have a higher level approval of the scaling up of the NGTS in other Southeast Asia countries by approval during the SEAMEO Council meeting. And we also established Southeast Asia School-Based Nutrition Promotion Working Group, where Dr. Ula is also involved in many of the meetings that we had during this Southeast Asia SBNP. In 2022, you know, there is a discrepancy of 2 years because of the pandemic, but we were able in 2022 to scale up the training of NGTS to 4 vocational schools in Cambodia, and we are currently in the process of providing technical assistance to this school to be able to implement the action plan. We also managed to document best practices of the implementation of NGTS in Indonesia. And in 2023, as I said earlier, 23 of Indonesian schools are in the phase of institutionalization. And a good news that we are scaling up our Nutrition Goes to School program in Malaysia. We will be having the training of the NGTS in Malaysia very soon, I think in the coming October. And we are currently in the discussion phase with Lao PDR to also start the preparation of the NGTS implementation in Lao PDR. So we are happy to have Dr. Ula, Dr. Pasok, and other colleagues from Lao to push through to push through the program of NGTS in the school. I think we are in the stage of selection of the school. I believe, yeah, Dr. Ula, that was the last discussion, and we will see how we can progress the NGTS in Lao after our important meeting last week. Yeah, thank you. Can we go next? Oh, there is a chat interesting about Lao and then school in the province. Interesting. Maybe we can also discuss later on about this, yeah? Dr. Saivi Sen. Okay, thank you for your chat. Can we go next slide?
Put I panesi
เอาเพิ่นไปปุ๊บเพิ่นไปปุ๊บ
ยัง
จอดที่นี่มันคือไปใช่นะ
บ่ทันไปยังคือเก่า In his computer already go other slide but
Oh, yeah, I think
show the same thing.
Yeah, it's okay. It takes some time, yeah, sometimes Dr. Ula because of the connection.
Can you see?
It's
So,
still not
So how
not
many
yet.
slides remain because now we 10:30 already.
Yeah.
เห็นว่าเอล่ะมันไปฮอตได้
ยัง
3แล้ว
คือเก่าคือเก่า
อ๋อโอเค stop เป็นกันเถอะ
Stop first. Okay. Yeah, I can go quickly on the
Yeah, you
NGTS
can, yeah.
program, and then we can go with the 4 examples of the paper.
Okay.
Yeah.
Can you
Okay.
see my slide?
Yeah,
Yes.
yes.
Yes, yeah. So those are the activities under Nutrition Goes to School program. Because of that particular initiative in SEAMEO RECFON, so from time to time when we do research regarding the school-based research, so we were able actually to put that in a good writing and then eventually publish in peer-reviewed international journal, or sometimes it is in Indonesian journal, which is a good learning also that I would like to share in this session. So I think this is the first one. We can go next slide. What is this study about? We can go to the next slide. The study is really about understanding the teacher's experience with nutrition education, because from time to time we sometimes, nutritionists sometimes think that nutrition topic is not well enough addressed in the school. Eventually, when we did this study, there are already some attempt in doing nutrition education, and we can assess actually the experience of the teachers, the teachers when they are conducting the nutrition education. So this is one milestone of the work from SEAMEO RECFON, where from this particular research, we improve our training because of the inputs coming from the teachers on what factors is necessary to make a nutrition education effective. So in this case, you can read here that we have, according to the school teachers, they say that teachers needs to be a role model. Yeah, teachers need to be a school role model. And then teachers also mentioned that school policy is very important to be able for the teachers to perform well in nutrition education. So I think this is a good learning as well later on for Lao. If we would like to implement NGTS in Lao, maybe we would like also to know what is the experience felt by the teachers. I think in essence, this is what we learn from this research. This is a cross-sectional study, by the way. Yeah, can we go next? The next study is also a cross-sectional study, but this time it is designed qualitatively. Can we go next? At this study, what we learn is really about the perspective from the students. So before in the quantitative study, it is on the school teachers. Now we are learning from the students what they want. Yeah, basically this study is really about understanding what is the interest of the student. Also, this study helped SEAMEO RECFON in improving our training design so that teachers are equipped with these feelings from the students. Okay, can we go next? The second one is also a qualitative study. This time, because of the pandemic, we would like to see the role of parents at home in influencing the feeding or the intake of the students during the COVID-19 pandemic, because most of the school-age children are having school from home. Okay, so can we go next? Basically, yeah, so this qualitative study is using a thematic analysis. What we identify is that we know what parents do with the students during the pandemic and how they play a role in influencing the diet, diet practices of the children during the pandemic. What is interesting from this study that we know from the parent side that parents actually demand their children to have a good eating behavior. However, because of their lack of time and lack of knowledge, the way their parenting style being performed is that they give freedom to the child, especially when it comes to snacks. So in this study, there were found that children are snacking more during doing school from home compared to when they are going to the school. This is also interesting fact. So this is also improving the way the way we deliver our training, because we want teachers also to be aware of what is going on at home. Okay, can we go next? I think the last study that we would like to share with you is on this topic, that is design. Can we go next? That is design using a mixed method. This is a cross-sectional study using a mixed method design. So what is interesting in this study is that the school community readiness level regarding school-based adolescent nutrition intervention is at the action phase. So they all know that they need nutrition intervention at school. They are aware that this is important, yeah. But what is the challenge is that even though they are already trying to organize efforts to address this issue, but they are in need of further assistance from external party. At this point, if you notice how NGTS program is run or implemented, the provision of technical assistance to the schools during the implementation of the NGTS is a key factor. And that is why, because SEAMEO RECFON is small, we also develop a collaboration with local academic partner to assist RECFON as the outreach of RECFON to assist or to give technical assistance to the school when they are implementing the Nutrition Goes to School program in their school. So this is also relevant with how we are conducting or implementing our NGTS program eventually. And I think we come to the last message, I think. If I may wrap up, can we go next? Yeah. So basically, these are the point that we discussed. Because of the time, I think I will just read through what are the key messages. So research can be categorized into various types, and each has its own purpose and technical use. The clear understanding on the exposure and the outcome defines what study design that we will choose. Okay. And a survey is a type of cross-sectional study design where we portray the exposure and the outcome at the same time. So we do not know which one comes first. But when you want to know the causality, you may want to do the experimental design. For cross-sectional study, we can only know the association. A survey can be designed as quantitative or qualitative, but we may want also to combine. Yeah, we may want also to combine when you think your research question require a combination of both quantitative and qualitative study design. And the last one, I reiterate before, when your objective is to understand the causes of an outcome, because you want to see a causal effect relationship. So it is not appropriate to use cross-sectional study, yeah, because then what you need is an experimental research design. I think with that, Dr. Ula, I would like to end my session. Sorry for taking up the additional time.
No, it's okay. Thank you. เนื่องจากว่าเวลาของเรามันก็จำกัดเนาะแล้วก็ถือว่าการสัมมนาครั้งนี้ถือว่ามีประโยชน์แก่ของเราหลายที่สุดโดยเฉพาะเป็นเว้าเรื่องโภชนาการในโรงเรียนเนาะซึ่งว่าทางศูนย์โภชนาการหรือว่ากระทรวงสาธารณกระทรวงศึกษาเฮานี้สิได้ร่วมมือกับเพิ่นในการเลือกโรงเรียนอย่างต่างๆซึ่งว่ามื้อนี้เพิ่นก็ให้เป็นแนวความคิดพื้นฐานให้แก่พวกเฮาแล้วเนาะดังนั้นถ้าว่าพวกเฮามีคำถามยังพวกเฮาจะขออนุญาตอีเมลหาเพิ่นแล้วในเดือนต่อไปหัวข้อมันก็ยังแม่นเกี่ยวพันกับประเทศอินโดนีเซียแล้วก็เว้าเรื่องโภชนาการในโรงเรียนอีกเนาะดังนั้นเฮาก็คือสิบ่ได้ถามเนาะมีแต่ว่าเวลาเฮามันค่อนข้างจำกัดแล้วก็มีแต่ขอแสดงความขอบใจนำจุดิสหรือว่าดร.ยอดสิเว้ายังบ่ทันมั้งDr. Nyasi, Dr. Nyot, Deputy Director of CN, would like to say thank you to you.
Thank you, Doctor.
Good morning. Thank you for your share nutrition project school. Good, very good. Thank you. Sorry, I speak English not well. I can speak loud and Vietnam. Okay. Thank you.
Thank
See
you.
you.
Doctor.
See you soon. Okay.
See you soon. See you soon. Thank you.
Okay.
Thank you.
Thank you.
โอเค ก็ขอบใจทุกๆคนเนาะขอบใจทุกๆท่านที่ว่าได้สละเวลาเข้ามาร่วมนำพวกเขาเนาะแล้วก็หวังว่าเดือนต่อไปเขาจะได้ลงเลิกอีกตื่มเนาะว่าเพิ่นจะเฮ็ดnutrition into school อยู่อินโดนีเซียเพิ่นคือแนวได้เพราะว่าเขาจะได้เรียนนำเพิ่นอีกเนาะแล้วก็ขอบใจดร. จูดิสที่ว่าสละเวลาอันมีค่าที่ว่ามีประโยชน์แก่พวกเขาที่สุดเลยเนาะโดยเฉพาะแม่นทีมที่เข้านี่ก็แม่นนักค้นครัวเนาะก็ได้รู้ว่าเฮาเฮ็ดการค้นครัวหยังต่างๆก็ถือว่ามีประโยชน์หลายๆเนาะก็ขอบใจพวกเฮาปิดการสัมมนาของเฮาในเดือนนี้เนาะเจอกันในเดือนต่อไปโอเค thank you bye bye
Thank you so much.
Thank you so much for
Thank you.
sharing
Yeah.
your experience. Thank you อาจารย์ลัทธิพร
เจ้าขอบใจโชคดีเด้อ
โอ้ย
ขอบใจเด้ออาจารย์ไซวิเซนดร. ไซวิเซน come from the นาฟรีเนาะแม่นบ่มาจากนาฟรีเนาะ National University of
Oh,
Laos
okay.
yeah
Okay. It is interesting. She is also interesting to put to have the program in the province, Dr. Ula. Maybe
yeah,
next time
in
we can
Singapore.
discuss. Yeah.
Because we still misunderstood. If we want to do this project, we have to have the money, something like that.
Oh,
But in
okay.
fact, when we learn from you, not necessary, right?
Yes.
We have to get the volunteer from the school.
Yes.
And
That's
using the school, they already have
right.
some activity on nutrition. Yeah.
Yeah.
So today make us more understand. Maybe we can recommendation to the Center of Nutrition how to implement. Yeah.
Okay, I will send you email and then maybe
sure.
we can try to fine-tune
Communicate.
how to collaboration and
Sure, Dr.
in fact,
Savisen.
my senior used to work with SEAMEO RECFON Laos, but now Dr. Silinthom.
Oh, Dr.
Oh,
Silinthon. Oh,
But
Dr.
now
Silinthon.
she moved to Ministry of Education, so we lost the contract and then on the program collapse. So that's why we try to link with other pathways easier.
Okay.
Like Dr. Latifon is our senior, so it's easier to talk to her directly, and then maybe we can do something more interesting. Thank you so much.
Yes, thank you.
Okay, thank you. Bye
Thank you,
bye.
everyone. Bye.
ขอบใจผู้แปล
See you
ภาษา
soon.
เด้อแปลได้
Bye.
ดีหลาย yeah.
Okay, thanks for sharing. Yeah, thanks for
you.
sharing. So we hope that we could create activities and we do research together in Laos.
Yes.
Yeah, thank you for sharing.
Thank you. See you soon, hopefully. Bye,
Yeah.
Dr. Ula.
Bye.
Please, bye.